first question is, which of the following condition is not suggestive of severe perinatal asphyxia? First option is cord pH less than 7. Second is Apgar score of less than or equal to 3 at the end of 10 minutes. Third is need of positive pressure ventilation for 30 seconds. Fourth is seizures within 12 hours of birth. So which of the following is not suggestive of severe asphyxia?
Dr. Joginder, we can give them like 1 minute. So most of them can answer and then you can give the answer.
So I need to tell the correct answer?
Yes.
Okay.
After they most of them have answered, then you can explain the correct answer.
Yeah, I think all have answered and all have correctly answered. So the correct answer is C, because we know that rest of the things, the severe acidosis, pH less than 7, Apgar score of less than 3 at the end of 10 minutes, and seizures within first 12 to 24 hours of birth are suggestive of severe asphyxia. PPV of 30 seconds is not that ominous thing. So the correct answer is C. Okay, we move to the second question. Which of the following staging or system cannot be used for assessing the severity of encephalopathy secondary to perinatal asphyxia in a neonate who is born at 34 plus 4 week of gestation? Maybe you can forget the gestation part. So the options are modify Sarnath and Sarnath, amplitude integrated EEG, Levin staging, Thompson scoring. Okay, we'll keep the gestation suppose at 34. Exactly what question says. Which of the following cannot be used to assess the severity at 34 plus 4 week of gestation? I'm getting a garden variety of answers, all starting from B, C, and D. So at 34 plus 4 week, which cannot be used. I think most have answered. But I did not get any of the correct person answering as correct. Mostly have answered B and D. So Thompson scoring is a, okay, one has correctly answered. So we know that Levin staging is used for preterm, right? Thompson scoring is again, you can be used for term and preterm. Amplitude integrated EEG can also be used for assessing the severity of encephalopathy if you are having flat EEG or burst suppression. Modify Sarnath and Sarnath is for 36 week and beyond. It is not applicable for 34 weeks because few components are not applicable at 34 week of gestation. They are gestation dependent. So the correct answer here is A. So that's why I have written a gestation of 34 plus 4. So I think only one has correctly answered. Next question is very simple. Which of the following organ system is most affected following perinatal asphyxia? Heart, kidney, brain, and adrenal. And that system was affected in index baby also. Okay, I think most have answered. Okay. So as we know that kidney is the commonest organ affected, although we do not see the manifestations, but typically if we look at the incidence, around 40 to 50% will have renal involvement. And the rest of the organs are relatively less affected. So kidney is the commonest organ. So correct answer is B. Most of you have answered correctly. I think 90%, more than 90% has answered correctly as B. Okay. So next is, which of the following is not true regarding the neonatal seizures? First is, HI is the responsible for most cases of neonatal seizure. Second is, levetiracetam is the most efficacious drug for neonatal seizure. Third is, high proportion of neonatal seizures are subclinical in nature. Fourth is, continuous EEG is the gold standard for detection and quantification of neonatal seizures, which is not true. We have discussed this thing. Okay, so almost all have answered, and all have answered correctly. The wrong answer is, levetiracetam is the most efficacious. We know that as of now, phenobarbital is the most efficacious drug, and that's why it is the drug of choice. Levetiracetam, so it is commonly used, but still it has not proven that it is more efficacious than phenobarbital. Rather, it is inferior as of now. So correct answer is B. Okay. So we move to next question. Which of the following has poor correlation for long-term neurodevelopmental outcome in neonates with perinatal asphyxia? So first is MRI done at 96 hours of life. Second is USG cranium done on day 1 of life. Third is neurological examination at the end of first week. Fourth is conventional EEG at 72 hours of life. So which one have poor correlation? None of them is excellent, but out of these four, which is the poorest? Okay, I'm getting all the garden varieties A, B, C, D. I think everybody has 25% chance to be correct. Okay, so mostly have answered as B and D. Okay. So correct answer is B. Ultrasound cranium has poorest correlation. It is generally said that USG cranium is only for excluding bleed in a baby with asphyxia on day 1. None of the other changes will appear. MRI, we know that at the end of 72 to 96 hours has relatively fair relationship. Neurological examination at the end of first week of life is fairly good indicator. Conventional EEG at 72 hours, and if it is normal, it is a fair indicator that outcome is going to be okay. But USG cranium on day 1 itself does not have that much. Somebody has said that ACRI has prognostic value. It has prognostic value, but not in an asphyxia. It does not have very strong thing in asphyxia that okay, on day 1 RI of this much will have poor development outcome. MRI, somebody is saying should be done on day 7. We know that it depends on the sequence, whether it is the conventional T1 imaging or we are saying diffusion weighted imaging. So here 96R probably I would like to include the diffusion weighting imaging so that we can see the diffusion restriction. Okay. So I think that's the end of the session. Dr. Kavita, over to you, please.
Thank you. We come to the end. Thank you, Dr. Joginder. The case discussion was a good learning session and MCQs also were